Good afternoon and welcome to today's webinar entitled The Healing Power of Art, Using Art in Treating Anxiety in Children with Developmental Delay and ASDs, presented by Alexandra Back of CNNH, the Center for Neurological and Neurodevelopmental Health. While acknowledging the need for education around specific topics, such as today's presentation, the Family Support Center of New Jersey also knows that families have specific questions around their child's transition years. The Transition Matters website assists families and professionals in identifying resources to successfully transition your child or students with special needs to adulthood. Resources such as webinars, in-person workshops, and statewide and regional contact information are made available on this site. We encourage you to explore this site further and register for upcoming sessions. Before we begin, let's take a moment to go over how you can participate during today's web event. Everyone has their own control panel in the upper right corner of their screen that looks similar to the one here. Use the orange arrow to open or hide your control panel. To listen to the webinar, you have two audio options to choose from: mic and speakers and telephone. If you can't hear well using your computer speakers, you can elect to use your telephone to listen to today's session. In order to maintain the best sound quality possible, all but the presenter will be muted throughout the webinar. If you have questions or comments, you can submit them using the questions panel. All questions will be collected and answered at the end of the webinar as long as time allows. At this time, I would like to introduce this afternoon's presenter, Alexandra Back. Alex, can you hear us?
Yes.
Perfect. So I'm going to go ahead and give you control so that you can get started with your presentation. Welcome, everyone.
Okay, great. Okay, hello everyone and welcome. Again, this is The Healing Power of Art, Using Art in Treating Anxiety in Children with Developmental Delays and Autism Spectrum Disorders. And again, my name is Alexandra Back, and I'm an art therapist. All right, so first I'm just going to go through what to expect for today's presentation. So I'm going to first go through my background and personal philosophies a little bit related to art therapy. I'm also going to talk a little bit about the creative arts therapies in general, and then go into a little more in depth about art therapy in particular. So I'm going to go through the history of art therapy very briefly, as well as its roots, and go through also, who may benefit from this type of service. Then I'm going to touch upon developmental delays and autism spectrum disorders, particular areas for growth and an emphasis on anxiety in particular, and then go through art therapy as a treatment intervention for this population, as well as some examples of how art therapy may be used. All right, so first I'm just going to start with my background. So like I mentioned, I'm an art therapist. My educational background includes a bachelor's in psychology from Penn State, as well as my master's in art therapy and clinical counseling from Drexel. Drexel was actually one of the first graduate-level art therapy programs in the nation, and they're strongly rooted in a psychodynamic approach, but also because they're so connected with Hahnemann Hospital, they have a very nice balance between psychotherapeutic approaches and a medical model as well. I received my clinical training across a pretty wide variety of sites. I've experienced in both inpatient psychiatric hospitals as well as outpatient programs. I also have experience working within partial care programs and alternative schools. I have experience with a wide range of individuals of quite a broad background, all different cultures, socioeconomic status, race, religion, life circumstances. And I also included on here a quote that I really think captures the idea of art therapy very well, and specifically how arts really coincides with medicine very nicely. So it says, the interweaving of the arts and healing is hardly a new concept, and it seems clear that this pairing is as old as human society itself, having occurred throughout history and across cultures. And so what I wanted to touch upon here was really that I think, an aspect of art therapy that sometimes seems a little bit mysterious is how the use of art can be used as a treatment intervention. But in fact, when you think back to, the beginning of when human beings, began using art, even something as simple as, cave images or cave drawings, people were really using art from the beginning of time to express what was going on with them culturally, socially, interpersonally, and really has been used as a method of healing for a very long time. Art therapy in and of itself really took hold as a separate and distinct discipline in the early 1940s and has since then really grown into a very broad field. So this is talking a little bit about just my personal philosophies practicing as an art therapist. So really, at my core, I really believe that every human being has the capability to be creative and expressive. This ability might not be readily apparent or might even, take a very long time to develop. But I think that, is intrinsically part of what makes human beings unique is that ability to be creative. I also really believe in art as a universal language. It really serves as a catalyst for growth in a broad number of ways. In particular, with art therapy in this population, serving as a means of connecting, interacting, and developing those social skills. I also personally believe in a holistic approach to wellness, so really looking at the entire person, not just their symptoms or diagnosis. So looking at all of their aspects, including, neurobiological, biological, any kind of family circumstances, as well as the greater society and community as a whole. All right, so this is talking a little bit about the different types of creative arts therapies. That broad title includes music therapy, art therapy, dance movement therapy, drama therapy, or sometimes it's referred to as psychodrama, and poetry therapy. If you'd like to learn more about what creative arts therapies are about, you can visit the National Coalition of Creative Arts Therapies Association's website. Okay, so at CNNH, we are very unique in that we offer 3 different modalities all under one roof. And this is pretty unique because a lot of facilities, may not have any creative arts therapy. And if they do, it's limited to usually 1 type, maybe 2 at the most. So it's very unusual to have all 3 represented in one facility. And what's great about that is that it really gives individuals choice and options and really is able to be tailored to already existing individual strengths and building upon those. All right, so I'm going to talk now a little bit about what exactly art therapy is. So this definition comes directly from the American Art Therapy Association, and it says, art therapy is a mental health profession in which clients, facilitated by the art therapist, use art media, the creative process, and the resulting artwork to explore their feelings, reconcile emotional conflicts, foster self-awareness, manage behavior and addictions, develop social skills, improve reality orientation, reduce anxiety, and increase self-esteem. And this also comes directly from the American Art Therapy Association. A goal in art therapy is to improve or restore a client's functioning and his or her sense of personal well-being. Art therapy practice requires knowledge of visual art, which may include drawing, painting, sculpture, as well as other art forms, and the creative process, as well as of human development, psychological, and counseling theories and techniques. Okay. So I'm going to talk a little bit about kind of the roots of how art therapy got started. So art therapy really is a kind of hybrid between a lot of different fields and a pretty broad base of knowledge. So it really comes from art education, visual art, as well as psychology. So it pulls upon art education in terms of the stages of artistic development. Many art therapists practice in a certain way where the initial few sessions may be an assessment period where the art therapist is evaluating the client to see what artistic developmental level they may be at. And this is done through a variety of different methods, most typically involving drawing or 2D media. And this really gives the art therapist a good sense of the individual and what direction to take in terms of goals and structuring each session. Art therapy also pulls upon the field of visual art, of course using art as part of the process. So these aspects would include nonverbal communication, which is the artwork itself or the art process, the materials and the media, so the choice of different types of materials, the aesthetics, color theory, as well as other elements. It also pulls from psychology, so focusing on theories of therapy, the symbolic meaning or imagery, sometimes dream analysis, diagnosing pathology systematically, and psychosexual stages of development. So while art therapy pulls really from all three of these different areas and incorporates many elements that are similar across all three areas, it really is a distinct discipline. So an art therapy session is not an art lesson. It's also not an art class. So it's very different and distinct in that way. And I view the primary difference as being the clinical intention. So art therapy is, a structured type of session, whether that be individual or group formats, where really it's about exploring that individual and exploring that space through the art making, but not specifically learning about an art technique or even creating an aesthetically pleasing result. Of course, both of those outcomes may occur naturally as part of the art therapy process, but it's not the main focus. So the clinical intention of the session is really the critical component and distinguishes art therapy as this unique discipline. The other big distinction, I believe, is that, of course, art therapy is led by an art therapist. The art therapist is trained in many, many different areas to be able to anticipate any kind of changes that may be occurring session to session, and being able to gauge the client's responses and tailor future sessions based on that. Okay. Like I had mentioned, art therapy can occur typically in individual or group settings. Each session is really as unique as the individual, him or herself, so no two sessions really look similar. The session is typically led by natural interests of the participant as well as their needs. So really it's about meeting the client where they are and guiding them along that process. One of the unique components of art therapy is that it relies on pre-verbal processes, so meaning experiences and opportunities that don't really require that verbal component. So it makes it accessible to nearly every client across any kind of level of functioning. Also, art therapy tends to include elements of other types of therapy. So a lot of art therapists incorporate cognitive behavioral techniques, psychodynamic techniques, things of that nature into their sessions, depending on the client and their personal needs. A lot of times, art therapy is referred to as psychotherapy plus because it really makes use of those psychotherapeutic techniques with the added tool of using art making. Okay. So who can benefit from art therapy? One of the most wonderful parts about art therapy is that it really can benefit such a broad range of individuals. So all ages, races, ethnic backgrounds, groups and individuals, but also families, couples, and communities. Anyone with developmental, medical, social, physical, or cognitive impairments can benefit, and truly any individual who's seeking personal growth or development. And again, because it relies on pre-verbal processes and doesn't make verbal language a necessary component, all functioning levels can really benefit from this type of service. All right, so now I'm going to talk a little bit about developmental delays in autism spectrum disorders in particular. And when I say that, I'm referring to autism, Asperger's disorder, and pervasive developmental disorder. So the primary concern areas across these diagnoses would be social and interactional, either deficits or disturbances, language deficits, so whether that be an expressive or receptive language, as well as sensory difficulties. Also, mood disturbances and anxiety can be common. Okay, so what makes art therapy a good fit for children with developmental delays? So art therapy is really very well suited to children in particular, but also children with developmental delays. The first reason why art therapy makes a pretty good fit for these type of individuals is because it's oriented towards process as opposed to product. And what I mean by that is the art therapist is looking at the overall process of the art therapy session rather than a product or an art piece at the end of the session. And this is really another factor that distinguishes it from other art disciplines. The process itself, the art therapist is looking at a variety of different areas, but they might be looking at, for example, are they able to communicate wants or needs? Are they able to problem solve? Are they able to withstand the sensory experiences that might be part of the session? And really looking at all those different elements across the session and helping to support them achieve those goals, as opposed to creating an aesthetically pleasing piece at the end of the session. Art therapy is also very success-oriented, and what I mean by that is that the art therapist really gauges the individual's needs and strengths and tailors the session to be challenging enough to meet certain goals, but not so challenging that the individual becomes dejected or becomes overly frustrated to the point of not being able to have a successful experience. So the art therapist training is really in this area and helping to gauge not only minute to minute within the session of where the client is at, but also seeing the arc of session to session, what is transpiring. So the art therapist really makes it very accessible for individuals to be able to have successful experiences. And this is helpful because this not only contributes positively to the therapeutic experience in that the client will want to return and be able to participate, but actually sees the experience as an enjoyable experience, which unfortunately a lot of therapies don't have that component. So for a lot of children with developmental delays, this is kind of not only a fun experience, but one that they can really benefit from and take with them the memories of having this successful, positive experience. It's also wonderful for children with developmental delays because it provides opportunities for interaction and connection. So as we mentioned earlier, some of the areas of concern for these individuals may be social skill deficits. So whether that be on an individual basis or in a group, it really provides a nice platform for that interaction and connection, but in a safe way, in a non-threatening way. So for example, a client with a developmental delay that may be working one-on-one with the therapist, they're able to build that relationship through the third space of the art making. And it's in a non-threatening way, in that the art making may be the primary form of communication. There might not be so much pressure to communicate verbally. There might not be so much pressure to sit one-on-one facing, having that direct eye contact that can be sometimes overwhelming. So it really creates a nice opportunity for them to engage in a way that they feel comfortable with and then build upon those skills. It also, in a group setting, provides a wonderful opportunity to meet other children, perhaps with similar concerns, but also having the opportunity to interact with them, and again, a really safe way. So they're able to have, this interaction with their peers and then take those, memories of having positive interactions with a peer into their next interaction. So it can already begin to eliminate some of that anxiety related to the social experiences. It also can contribute to a sense of belonging and community. A lot of individuals, who do have developmental delays or autism spectrum disorders are looking for that sense of belonging and community. I know that a lot of individuals that I see, on a regular basis want to have those experiences, but perhaps don't know how to achieve having those interactive experiences. So coming to art therapy can really bring that sense of belonging that, hey, I have something to contribute, and here it is, and this is something that's an ongoing positive experience for me. And also, of course, in the sense of art therapy groups, it really helps them to have that sense of community that there are other kids like them, that there are other kids that may have similar challenges, and having the peer modeling of being able to overcome those challenges through the art therapy can be really powerful. Art therapy also can be tailored to individual needs, as I mentioned, as well as preferences and areas for growth. So again, unlike some other therapies or more traditional therapies, it really becomes very tailored to the individual because of the art-making component. So they're able to assert their independence by selecting materials or selecting the size or scope of their project. And of course, the art therapist assists with this process. And so that really makes it something that's enjoyable for them while also encouraging growth in those areas. And like I mentioned also, it's of course a non-threatening form of therapy. So the individual does not feel pressured to rely primarily on verbal skills or perhaps work one-on-one where the only interaction is just with this other person. It creates this third space of the art making that really removes a lot of that tension and stress. And then of course verbal language is not required. The other component that really makes it a great fit for children with developmental delays is that children on the spectrum are often very visual, concrete thinkers. So art making can naturally tap into the way that they already process information and can be something that they naturally relate to. Okay, so now I'm going to talk a little bit about the different goal areas that art therapy can address. There's a pretty wide range of these, and they include communication skills, confidence and self-esteem, social skills, self-regulation, developing coping strategies, and of course, reducing anxiety. Okay, so I'm going to go through each a little bit and then really focus on anxiety because even across all of these areas, these goal areas, anxiety really can come into play with each of these. So we're going to start with communication. So art therapy assists in increasing communication by increasing independence and a sense of mastery by making choices. So the individual may have to make choices, whether verbally or non-verbally, about what size paper, what size material, what size brush, what type of material, what color. So within the art making, there's the constant need to make choices. Sometimes the art therapist may structure this where there's one or two choices. Other times it may be open to more. But again, it's tailored to the individual's needs and where they are in terms of functioning. And so it really increases the communication in that it provides this alternate form of communication while at the same time encouraging verbal interaction when possible. And the individual really perceives that sense of mastery because they are able to make those choices and make decisions within the context of the session. It also helps in terms of creating a healthy means of expressing emotional states. So perhaps the individual is having a difficult time expressing verbally what's going on with them. It provides this opportunity for them to put it into the paper, put it into the art form, and then they're really able to communicate in a way that feels safe to them and, again, non-threatening. It's also helpful because these skills can then be translated to other settings, for example, with caregivers and parents at home or in the school setting or even in the larger community. All right. In terms of confidence and self-esteem, again, like we touched on earlier, art therapy really is based upon the idea of success-oriented tasks, especially for this population. So although some challenges may be purposely designed and incorporated into the session, they are really geared to be achievable and simultaneously working on coping strategies to help achieve those goals with the art therapist. So in terms of the actual projects or art pieces that are created, simply having the completion of these pieces can really help build that self-esteem and confidence in the individual. The art-making experience also allows the individual to explore new aspects safely. So a lot of difficulty that I've seen in clients that I've worked with developmental delays is in the area of transitions or changes. And actually this area can be very challenging for individuals not on the spectrum as well. So it allows individuals in general to really explore new things, changes, transitions in general in a safe way. So they might know what to expect in the context of the session or the flow of the session, but perhaps I introduce a new type of material or a new type of task directive, and I assist them in this process. And while they're going through this experience of trying something new, they're able to not only use the coping strategies that we've been working on within that, but they're also able to develop new ones and practice them at the same time. And these aspects are really wonderful in terms of translating to other settings, and that again they have this tangible, concrete example of a time where they tried something new and could be successful at it, and perhaps it wasn't so scary as they initially anticipated. And this has really been a very powerful element in terms of boosting the confidence and self-esteem overall. And then again, of course, the tangible product. They have this kind of concrete visual piece that reminds them of mastering these new challenges. And having all those positive associations to it can really help in terms of, making the initiation the next time to try something new, or perhaps even just tolerating the experience of having some element of change. In terms of social skills, there's several different areas within social skills that can sometimes be very challenging for individuals that are on the spectrum or have developmental delays. And these areas include communication, eye contact, direction following, self-awareness and awareness of others, general boundaries, attunement, engagement, and frustration tolerance. And all of these areas in particular can sometimes create anxiety in relation to future social scenarios that they may encounter or interactions. So in terms of the art therapy process, it really helps all of these areas in that we practice all of these experiences within the context of the session and help build upon these skills. And then again, because they have this positive experience, they're really able to then translate those to other settings. So in terms of the different areas here, I'm going to focus a little bit on self-awareness and awareness of others as well as boundaries for a minute. So the art therapy session, whether that be individual or group settings, really helps target this area. So in particular, the self-awareness can be lacking, as well as the awareness of others for individuals that have developmental delays. And so art therapy, naturally, because you're creating pieces and you're being asked to reflect upon them, it helps encourage that self-awareness, whether that be small things like attuning to the fact that you selected this type of material, or larger things like you came into a group session and did not make eye contact or communicate with other members all through the session. The art therapist may incorporate these elements into the session and create tasks that encourage these skills and then bring them to the awareness of the individual so that they might have the opportunity to practice them and build upon them. And in terms of boundaries in particular, the art therapist is really able to encourage not only appropriate physical boundaries, but also boundaries within the artwork itself. So for example, there might be deficits in boundaries where they're unable to select one type of material to use at a time, or they may, for example, the directive may be to create something in a certain area, and they expand far beyond that area and into other people's personal space. And so really the art therapy session in and of itself helps them to become aware of these personal boundaries, and then also can reduce anxiety about being in similar shared spaces with others and having their boundaries somewhat more imposed on them they might like or might prefer, and really helping them to become comfortable with being around other individuals and sharing that space. And then the other areas, of course, attunement, engagement, and frustration tolerance. Those are also critical social skills as well. Attunement to tasks, meaning the attention and sustained engagement paid to the task. The individual is really able to practice those skills by completing projects across sessions. So for example, the art therapist may design a project that lasts 2 sessions, and they need to decide what amount of work they're going to complete within each session. And then moving forward, they're able to have this concrete piece that they were able to sustain their engagement with across multiple sessions. And this really helps build that focus and attunement, as well as in terms of the particular directions of the task. It also helps build frustration tolerance because, of course, naturally, a lot of these different elements, whether that be, sensory type of experiences, projects that are very challenging that perhaps they've designed that they're unable to complete, not having access to a particular material when that was, their expectation. It really helps build up the tolerance to those specific frustrations, and also provides them an opportunity to practice strategies that they've learned in order to self-regulate and bring themselves back down to a level where they do not feel frustrated. And that brings me to self-regulation, which is another big area that, especially in terms of anxiety regarding social scenarios, having that kind of heightened anxiety, anticipating those social interactional experiences, it's really important that the art therapists work with the individual to help them learn tools for self-regulation. And by self-regulation, I mean the ability to monitor the self and respond appropriately. So that may include identifying, personal needs and then seeking the appropriate support. So whether that be something as small as identifying that something is overwhelming and that you need a break, being able to communicate that and seeking support, whether that's from the art therapist or if in a group setting, the other members. And then, of course, also self-awareness comes into play. So while you're working on, building up those skills, you really do need to be self-aware and aware enough to ask for and communicate needs. So again, this can be done verbally or non-verbally through the art therapy, and that's what makes it a really great fit for many individuals. And then, of course, utilizing the coping strategies that the art therapist designs with the individual to help bring them that sense of self-regulation. Okay. And so in terms of coping strategies for managing these different areas and any anxiety that may arise as a result of the deficits in these areas, the art therapist works with the individual to create tangible, concrete techniques. And these strategies may include art or they may not. Oftentimes, we'll start with the art as part of a coping strategy. So, for example, having a physical release into a material. If, for example, looser materials such as Play-Doh or clay are well tolerated or even enjoyed in terms of that sensory feedback, a lot of times we'll use those as a way to discharge and release frustration, really channeling it into the art making. And if those experiences aren't well tolerated yet and those areas need to be developed, perhaps using something more concrete or more structured, such as colored pencils or markers, and being able to make markings on a page extremely forcefully to get out some of that frustration. So small things like that, and kind of immediate things you're able to use within the session, but also more concrete techniques to use outside of sessions. For example, coupling, creating an art piece with beginning and ending exercises using breath work, using that kind of mindfulness-based experiences to really help the individual self-regulate and know that they have the mastery over their experiences and being able to cope with the challenges that arise in the session, and then as well practicing them at home and school settings. And this also contributes to confidence, and that individuals are able to develop the ability to self-soothe and, again, have the mastery over their environment and their responses. Okay, so now I'm going to go a little bit deeper into anxiety and individuals with developmental delays. So in terms of this area in particular, anxiety in general, may occur at clinical levels with individuals who have developmental delays or autism spectrum disorders, and also subclinical levels. Many individuals that I've seen do have some level of anxiety day to day that they are working on, becoming, having that become more manageable for them. I know this area in particular can be very distressing to caregivers who maybe recognize the signs of anxiety in their children and aren't really sure what to do that can help them and to release some of that tension and stress, as well as kind of minimize their overall experience of anxiety. So some of the areas that might contribute to this, and I've touched upon some of these briefly, but definitely the area of social skills. Having those deficits in the social skill areas, and then that coupled with the expectation to interact and to have different social experiences, whether that be in the home setting, family setting, school setting, even in free time and kind of other social settings, having that expectation can put a lot of pressure on an individual, especially when that is an interactional experience that's very overwhelming to them and perhaps very challenging for them to engage in. So having those deficits and then having that expectation can really create a sense of anxiety. Another area that really can contribute to having some anxiety for these individuals is the sensory aspect. So a lot of individuals do have sensory disturbances in terms of whether that be an overload of sensory information and input, or that they are seeking sensory stimulation. So the buildup of anxiety, before being able to have that sensory input can sometimes be very high. And then also for other individuals, having too much sensory input can be overwhelming and can really contribute to heightened anxiety as well. Again, somewhat touching upon an area of the social skills, but having poor communication skills and deficits in this area can really contribute to anxiety pretty strongly. And the reason for this is that a lot of individuals have lower language abilities, or even if they do have typically high-functioning language abilities, they may have challenges with communicating their needs and wants, communicating what their inner experiences, and communicating with others just in general. And having these lower, level communication skills can really contribute to having a sense of anxiety and anticipating interactions, but also day-to-day and making sure needs are met. Another area that I don't believe is often considered or talked about is the vulnerability of this population to bullying and aggression from peers, which of course can contribute to anxiety in the individual. Across school settings, they've made a lot of strides in the past several years regarding this area. However, unfortunately, it's still a concern. So a lot of individuals that do have developmental delays, especially during those elementary and middle school years, can be subject to bullying and aggression from peers when perhaps that information isn't made readily apparent to them. So they may experience anxiety in this way as well, and anticipating these interactions that may be more negative and things like that. Okay. So I'm going to go through a little bit now how art therapy in particular can really target anxiety in individuals with developmental delays and autism spectrum disorders. So having the deficits in social skills is obviously an area that we would want to work on. So again, it's a platform for interaction through the art therapy experience. It's a positive experience as well, which is excellent for contributing to engagement in the session. One area that we really focus on is related to social stories. So we'll use elements of art making such as comic books, storybooks, self-portraits, any kind of element that incorporates a safe reflection from a distance. So really being able to create these art pieces that are geared towards themes such as conflict resolution among peers, how to initiate interactions and have greetings and goodbyes, practicing perhaps unique situations that caregivers or parents are anticipating and want to make the art therapist aware of. So the art therapist is able to then tailor the session to being able to practice those unique situations through the art making so that the individual knows what to expect and perhaps has almost a concrete schema for what type of things they can expect in that type of situation. They also, through these different social stories, they can also process events after the fact. So if an event took place where perhaps the social deficits came into play and it was a very challenging situation, the session, the art therapy session can be used to process those events and also practice what could be done if a similar situation arises the next time. It also allows for social interaction at their pace. So while they're working on these social stories, through the art making, the art therapist and the individual are interacting as well and having that shared experience with the art making. So in terms of sensory disturbances, art therapy really helps with anxiety related to this area by exposure. So, we typically would never ask an individual to dive right into a material that is really challenging for them. We would gradually expose them to it and build up their skills. And that can occur across, a few sessions or several sessions. So it's really assisting in helping them to build the tolerance for these certain types of media, but also helping them to not have the avoidance response. So a lot of times individuals that have these sensory disturbances will avoid these type of scenarios, whether that be tactile sensory disturbances or auditory sensory disturbances. They'll avoid those type of situations, and that can actually sometimes contribute to even further heightening anxiety and building up an even more increased stress response when those situations do become encountered. So the art therapist, for example, in terms of tactile stimulation, may expose them gradually to looser media like clay, Play-Doh, finger paints and traditional paints, watercolor, things of that nature. In terms of auditory disturbances, perhaps the sound of the brush, perhaps the sound of even no sound, of having the silence of the session room. So being able to gradually build up the tolerance to those experiences in a safe way. This also helps for younger individuals develop school readiness. So perhaps preparation for being, the expectation of having to tolerate these type of experiences in a school setting. So really exposing them and being able to build up coping strategies safely within the session in preparation for those experiences. It also helps normalize the experience. So I think a lot of individuals who are struggling with anxiety at any level, may feel that, it's just them or that they're really different for having these experiences. And it really normalizes it in that everyone, experiences anxiety at some level to some degree. It's just how to manage those feelings and being able to have appropriate responses to that anxiety, as well as being able to make use of the effective coping strategies that we work on. In terms of communication and anxiety related to this area, Again, art therapy can be verbal as well as nonverbal, so it really can eliminate some of the anxiety of having to have an entirely verbal session. It encourages this interaction, but it does not force it or make it a requirement. And also it occurs at their pace. So again, they'll have these positive memories and associations of communication as a tool for success, as opposed to something that they're not comfortable with and not able to engage in. And also, it also contributes to being able to have increased communication amongst parents and caregivers and other individuals they might encounter in the school setting. So they're able to communicate when they're overwhelmed or upset, perhaps by drawing, as opposed to verbalizing in that moment. It can create a sense of safety and trust with parents and caregivers, and also get their needs met of having to express those emotions and needs and wants. All right, and at this time, I'm going to take a few questions. So I'm going to turn it over to Yvonne, and we'll get those started.
Very good, Alex. Thank you so much for that informative information. And we did have a couple questions that came through. So the first question that we have is, my child doesn't have artistic skills. Would it still be a suitable mode of therapy for him?
That's a wonderful question, and that's actually a question that I hear quite frequently. For all of the creative arts therapies, not only art therapy, having experience or even having a base interest in the art form, it's absolutely not a requirement for participating. A lot of individuals I find, maybe even hesitant at first in terms of the art making and having that as part of a component of the session. But really, it's not a critical component, because all human beings really are able to create, and the art therapist, is skilled in being able to facilitate those experiences, and really also being able to identify what works for them. Some individuals really prefer 2D media, and some prefer 3D media. I've had several individuals, over the past several years, that the art making actually becomes less and less a part of the session, and perhaps just a way to transition in and out of the session. And the rest of the session might be working on other areas or communicating verbally or things of that nature. So absolutely, it's not a requirement. And having experience with art making is also not a requirement. Really, it's about expression in general. So it's absolutely not about, creating this, like I said, aesthetic piece. So the experience component is also not, a requirement.
Wonderful. Thanks so much, Alex. And in terms of creativity, a parent had mentioned that they're not particularly creative as a parent, they feel, and they were wondering if they could still reinforce skills that an art therapist uses with their child at home.
Absolutely. And I think, especially working with children, one of the biggest components is that you'd like to see the skills translate to other settings outside of the session. It would be wonderful just to have, these skills developed in the session, but it wouldn't be as effective if they weren't able to be made, for use at home and as well at school. So absolutely. A lot of times, parents that I've spoken with have been able to utilize the coping strategies that we work on within the session in the home setting. So often I'll create perhaps a visual guide or visual prompts for different coping strategies that we might be using in the session, and then provide those and educate the parents on them as well, so that they're able to encourage their child to use them, when appropriate, and we'd be able to discuss that as well. The other component is, even within the school system, being able to use the art to express different things. So I've had individuals in the past where, their biggest challenge, or one of their primary goal areas, was really frustration tolerance, and that really disrupting them throughout the day. So we, had strategized to be able to have breaks built in where they're able to use art making during that break time, and then return back to the task at hand, whatever that might be within the school day. So there's absolutely ways, to incorporate the elements that we work on to other settings, and the individuals that, help facilitate that absolutely do not need to have any kind of art experience in any way. Again, it's really mostly about expression and about developing these different skill areas.
Thank you so much. Another parent had a concern. They feel that art therapy would be very beneficial for their child. However, finances sometimes tend to be a challenge. Are you aware, is art therapy typically covered by insurance companies?
Yeah, so certainly if you had specific questions about your individual insurance providers, I'd encourage you to contact me directly here at CNNH, and we'd be able to go through that. We do have a lot of insurance providers that are in network with us, and that makes some of our services more affordable for families, and a lot of individuals have found very reasonable payments through that. So I'd encourage anyone who is interested but just wondering about what the cost would be to contact us directly.
Thank you. That's good to know. Another question came through. If my child has dexterity issues, can they still benefit from art therapy?
Yes, absolutely. That's another really great question. So the art therapist would be able to really tailor whatever strengths the individual already has to the art making process. So if there's concerns about dexterity, the emphasis might be less on particular types of media and more on other types of media that they would be able to find success with. There's also a lot of different strategies within art therapy for tailoring certain experiences to physical disabilities or even just regular physical demands, such as issues with dexterity. So for example, using different size and shaped markers, using different types of brushes that are more tailored to those gross motor movements as opposed to the fine motor experiences. So there absolutely are ways of adjusting that, and that would be something that the art therapist would be able to assess during that initial session to see what would be needed to move forward.
Perfect, thank you. And there was one final question that came in, and this is in relation to CNNH itself. Just a general question, where is CNNH located? Are there a number of locations throughout the state? And do the art therapists travel to the families' homes?
That's another really great question. So CNH does have several locations located throughout New Jersey and Pennsylvania. I'm based out of our Voorhees location in Voorhees, New Jersey, which is southern New Jersey, right outside of Philadelphia. We also have locations in central Jersey, Wall Township, also North Jersey and Rutherford, and we also have a King of Prussia location in Pennsylvania. Currently, the art therapy is only available at our Voorhees location, but we are always working to get more services available at other sites. So definitely, if you were interested, I would say reach out and we can talk more about what other options there might be in the meantime. We also have ongoing waiting lists for individuals that would prefer to have a specific type of service at a location closer to them, and are always gauging our services based on that as well. So I'd really encourage anyone who is even mildly interested to contact us, and we'd be happy to speak with you about it.
Thank you, Alex. And is there a particular age span that you work with?
So through CNNH, I see mostly children through teenage years. I also do have a few clients that are adults, but I have experience working with full range, as young as 2 through older adults in assisted living facilities. So we really do make it available to anyone who could benefit from it.
And is it ever a case where someone is too young or too old to benefit from art therapy?
I would say, I think 2 is about the youngest for art therapy that would be possible, just because that's, the beginning stages of art development. And earlier than that, would be challenging, and the benefits, I would be wondering what the expected benefits would be. Certainly that might be more suited to a different type of therapy, but certainly there's really no age limit. I've seen individuals, in their upper 90s participate in art therapy successfully and really gain benefits from it. So definitely it's a pretty broad range.
Okay, perfect. And a question just came in too. We have a professional attending with us today working in early intervention. So would you see art therapy being a great tool for a professional such as this one to use with kids typically birth through 3?
Sure. So art therapy really can be a great, aspect for early intervention type of services. I would really recommend if someone is interested in that, in having an art therapist be part of that process. Certainly there's benefits to incorporating art making into any, level of any experience, but really an art therapist has the, knowledge and training to be able to know what types of media elicit certain types of responses, looking for certain graphic indicators for different areas that might be of concern, and being able to make the appropriate interventions. So that is what I would recommend, but certainly I think, incorporating artistic elements and exposure to individuals, is great at any level.
Thank you so much. And is there anything else that you would like to share with us before we conclude our presentation today, Alex?
I'm just going to provide everyone with my phone number here so that if anyone is interested in services or learning more, they can do so. They can also visit our website at www.cnnh.org. My phone number here is 856-346-0005, and you can reach me at extension 1406.
Thank you so much. And if anyone was interested in viewing an archived session of this presentation, we make sessions available a week after the recording date on our website, www.fscnj.org. So without further ado then, I'd just like to thank you so much on behalf of the Family Support Center of New Jersey, Alex, for sharing your knowledge with us today. And thank you all
for having me.
Yes, thank you so much. And thank you all for attending. This concludes our afternoon webinar, and have a wonderful day, everyone. Thank you.
Thank you.
Bye-bye.